As you all know, the pan-epidemic of coronavirus COVID-19 has disrupted the affairs of the entire world. In this conference, we're lucky to have gathered an international panel of experts from several countries, 3 continents, to review the policies and the public health initiatives that have been proposed and executed throughout the world. Most importantly, we are focusing on the policies and approaches that have affected Iran, the country with the highest mortality rate based on the unofficial reports coming from inside Iran. With that introduction, I would like to turn our attention to our panel of guests. Our first speaker is participant is Dr. Amir Sadegpour in Australia, and I want to appreciate and thank Dr. Sadegpour because I think it's about 3 a.m. in that part of the world, and he's been awake to talk with us. And my question is, in regard to this pan-epidemic, what factors would be efficient or effective in terms of the prevention? And in your opinion, the policies that have been adapted in Iran, whether this would allow us to get a better control in that situation. Dr. Sadegpour?
Hello, everyone. Thank you for having me. My name is Ali Sadegpour. I'm a doctor of public health practicing in Australia, Sydney, Australia. To answer your question, I actually have to say that the policies that Iran had implemented after the first coronavirus or COVID-19 was identified, it's actually not the, how can I say, it's not only the policies, it's actually something that put everyone in the country at risk. As we all know, the first case of coronavirus was identified early February 2020 in Iran. However, Iranian government not only canceled the revolution anniversary on 11th of Feb, and also their fake election on 21st of Feb, they actually encouraged people to participate on those events. It is well known by everyone, and every time it's recommended by WHO that when there is coronavirus in the country, you have to avoid public gathering. It's, as you know, in the general level, they ask people not to get together, keep the safe distance from each other. The schools are closed, the public transportation are closed. But unfortunately, Iranian government, that there is no doubt in their incompetency and trustworthiness, they actually encourage people to get together and do go for the election and voting and also the anniversary of the revolution. So countries like Australia that we are living in, they have put in place a lot of proper preventative measures to ensure that the control and to minimize the impact of coronavirus. So one of the things that Australian government has done, which is to some degree has stopped the spreading of the virus, is that all the people that coming from overseas, they do 14 days of the self-isolation. Also, on top of that, they have implemented a lot of policies that, schools, all the sport gathering, all the sport events are canceled, and people, they're wearing masks. Personal hygiene and sanitation has been very promoted, and all the equipments and things that public they need, the Australian government put at their service. Also, the Australian government had allocated $750 to each person that they cannot afford or they are under social security, to spend that $750 on the items that can stop spreading of coronavirus.
Thank you so much again. Thank you for being up in the middle of the night for us.
Thank you. Thank you for having me.
Thank you. The next guest is Dr. Sajjadi from U.S. Dr. Sajjadi, as you know, the regime's statistics from the infected and mortality and morbidity of the coronavirus in Iran is filled with deception, and the rest of the world is looking at it as a pure lie. Could you please explain to us the status of the real statistics in Iran, and again contribute to the point of how the mismanagement of this whole crisis has contributed to this tragedy in Iran?
Hi, I would like to salute our physicians and nurses and healthcare professionals in Iran for providing care to our people and coping with this tragedy. As far as the statistics, in ordinary situations, this is the government which provides the country and the world with the actual numbers and figures regarding an evolving epidemic such as this. However, we're dealing with Iran, which is a very special case because this regime considers people as the main enemy. So how could you provide the main enemy with the accurate information? And also another factor is that this regime is so unstable and brittle that it's fearful that providing any accurate information to the people, and the fact that the main culprit here was the regime for this widespread of epidemics. So it's fearful that accurate information might cause civil unrest or would give another reason for people to rise against the regime. So therefore, here actually I want to take time and give you an example of how this regime conceals the accurate information from people. There was a report in Risalat Daily, which is a state-run newspaper, and this is the actual quotes from the paper. It says, with regard to the number of infected nurses, we cannot release any figures. The statistics are completely security related and cannot be revealed. Even the heads of hospitals might not know of the number of coronavirus victims. Even if a victim goes to the hospital, the statistics are not given to the hospital supervisor. So if the statistics are security information and not to be revealed to people, how could you trust the numbers that this government gives out? So therefore, we need to come up with other means of arriving to some numbers which gives us the actual dimensions of this tragedy happening. So we could study the population or specific groups of the population, specific groups that have been more closely monitored. I want to draw your attention to a report that in one of the provinces.
Dr. Sajjadi, sorry to interrupt. I'm getting we have some urgent messages from inside Iran. If you don't mind holding on to your points, we can hear some of those messages which are precious.
Go ahead, please.
In the meantime, I'm getting the questions from the newspaper agencies here. در زمان میخوام سلام برسونم به وطنهایمون در داخل ایران با تشکر از اینکه دارین به این برنامه نگاه میکنین. همونجوری که گفتم پزشکای دردمند ایرانی که در تمام دنیا هستند و به علاوه چند تا متخصصای غیر ایرانی اینجا رو ما جمع کردیم با کمک سیما تا مسئله این تراژدی بیماری کرونا رو تو ایران جواب بدیم که بشه چجوری میشه یه سری راهنمودهای عملی برای مردم ما که الان در خاک و خون ویروس کرونا را میپیچند انشالله که بتونیم کمک بکنیم. سوالاتون رو لطفاً به کانال ها و تلفن هایی که هست وصل بکنید تا ما انشالله بتونیم تو وقت محدودی که داریم جواب بدیم. So, Dr. Sadaqpour, I'm asking you a question until I think the connection gets. One of the reporters have asked that Ms. Rajavi has requested that the loan, the WHO, the World Bank loan to Iran, should be given directly to Iranian people. Do you think that? Could you elaborate on how basically people and the medical professionals in Iran basically could use this? So, if you can prepare your comments until I see where the connection from Iran is going to happen or not, that would be great.
Sure.
And I appreciate Dr. Sajjadi, who's holding on to his comments. Dr. Sajjadi, please go ahead and finish your comments until we get the, I think, from the part. Sorry.
Sure. As I was saying, that the question becomes, how could we arrive at the dimensions of this tragedy? One was to study the general population and specific groups within the population that are monitored. As far as the general population, one indicator would be the number of admission to the hospitals or bed availability. There was a report that in Golestan province, which is about 2% of population of Iran, they have 2,600 hospital beds, and they were basically occupied and in full capacity. Majority of these beds were taken by the patients infected with coronavirus. And if we give a number of, let's say, 2,000 to this population, given the fact that at any point of time, just 15% of those infected with virus end up in hospital, we arrive at a number of 13,000 infected within the state, within the province. And if we extrapolate that over the Iran population, we get a 600,000 infected with the virus. And again, we need to realize many people have recovered from that. So with that in mind, we get to 1 million. The other thing is that the hospitalization lags the actual activity of the disease. So with that in mind, actually we arrive at a number of 2 million infected in Iran. Now, as far as specific groups, smaller groups, one group would be travelers. There was a study by a Canadian university that they noticed that on February 23rd, meaning early on, many of the Iranians that they arrived at destination abroad were infected with coronavirus. And with the travel volume, they arrived at a population of near 18,000 within Iran, which could support such a number of infections of the travelers. And now, if that was in February 23rd, if we take into the fact that there's a doubling of every 3 days, we get in excess of 2 million today. Another group would be the Parliament of Regime, the so-called Parliament. It has 290 members, 23 of them been diagnosed with this, which is 8%. The other one is the Rouhani's cabinet. Out of 30, we've got 2 members infected, which is about 6% or so. Also with another group would be the advisory council of the regime. Out of 39 members, 2 have died. So we get to a number of roughly 6% within these groups. And if for the whole population, that would become 5 million. In summary, we're dealing with millions infected. And also the reports we get from Iran, from ordinary Iranians, healthcare professionals, as well as the resistance units. As of yesterday, there's been 4,500 deaths to this coronavirus. If I can get another minute or so, I can explain.
If you can just do it quick in about 15 seconds, because we're getting a lot of questions from inside Iran. Just finish your points, please. Yes.
Yeah, sure. Just as far as the sanctions, I want to tell you that the U.S. laws does not allow sanctions on food and medicine. So this is regime trying to put pressure on US to relieve the sanctions. Otherwise, medicine could go to Iran. The problem is that the regime's institutions, all of them are involved with terrorism. And so many European banks are afraid that, they would be under sanctions if they deal with terrorists. That's all.
Thank you so much, Dr. Sajjadi, and sorry for the interruption, because I'm going to speak Farsi because there's some questions from inside Iran. دوستان و عزیزانی که در ایران دارن به این گوش میکنن، سوال اصلی این هست که ما چی کار باید بکنیم به لحاظ پزشکی. به نظر من جواب سوال شما رو رهبر مقاومت آقای رجبی خیلی تمیز و روشن دادن. امکانات داخل ایران از بیمارستان، دوا، دارو، ماسک، اینا مال شماست. اینها تعلق به شما داره و اگه اینو بخوایم به سر رژیم بذارین نخواهد داد. اینا رو به خودیای خودش خواهد داد، تو بیمارستان‌های سپاه نگه خواهد داشت. حق رو باید گرفت و اپلیکیشن حق الان در موضوع کرونا ویروس به اصطلاح امکانات هست. باید برین تو بیمارستان‌ها، دواخونه ها، تو کلینیک ها و امکاناتی رو که میخواین به طور خاص اون جاهایی که سپاه هست، اون جاهایی که بسیج هستن، این امکانات رو بگیرید. کسی اینا رو از ملاها از پدرشون به ارث نیاوردن. اینا امکانات شماست، امکاناتی که کشورهای دیگه به ایران دادن تا به دست شما برسه. تو هر شکل و شیوهی که میتونین برین و امکانات رو بگیرید تا مسائلتون رو حل بکنید. و با اون من برمیگردم به دکتر امید که دکتر امید شما اگه میتونین خیلی خلاصه به این پاسخ‌ها جواب بدین و اگه هر کدوم دیگه از or any of other guests who have any comments about practical questions for Iranian people, what shall we do? In the situation that the government's policy is not working for us, what can we do? Dr. Omid?
I guess as you mentioned, should I speak English? I mean, if the government is not looking after the people, which this government have not done in the past 40 years, as you mentioned, people are responsible to take control. In some degree, they have to demand their rights. If it's not given to them, they have to demand it. So, as you mentioned, going to the hospital and asking for their right, which is they have to be looked after, all the medical equipment, all the medical services, it belongs to them. The Iranian, that government sucks the blood out of these people, and these people, they need to ask for it. Otherwise, this government, as you mentioned, the only people they look after is their officials and Revolutionary Guard. So they don't care about these people. Yep. Iranian people.
Dr. Said, could you give us some Farsi, basically medical, practical answers to people that what is it that they should do? Wash their hands, covering their noses and so forth. So please.
Sure. باید دستاشون رو همطور که گفتم از لحاظ personal hygiene, it's very important. خیلی خیلی مهمه. چون تنها راهی که میتونیم الان اگه گاورمنت کمک نکنه ای که حتی خونه بمونیم برای 14 روز و دستاتون رو مرتب هر 5 دقیقه بشورین، سانیتایز کنین، دسته در رو سطحایی رو که باش تماس میگیرین و اگه کسی رفت بیرون از خونه و برگشت مطمئن باشین اون نفر دستشو بشوره، لباساشو عوض کنه، چون یکی از راههایی که میتونه انسانایی که تو خونه هستن آلوده بشن که این مریضی از بیرون وارد بشه. ولی چیزی که الان بعد انجام بشه از دور هم رفتن دوری بشه، پرسونال هایجین همطور که گفتم دستتون رو شسته بشه و سانیتایز کنید.
خیلی خلاصه بکنم برای هموطنان، این ویروس از 2 طریق مختلف، یکی اگه شما در چند متری یا نفر هستین بعد عطسه و سرفه میکنن میاد تو هوا، ولی تو هوا خیلی زیاد نمیمونه. دوم روی سطح میمونه، رو سطح صاف یا سطح سخت. سطح سخت مثل دیوار و میز و این حرفات میگه حدود 2 روز روی دیوار و میز خواهد موند. در اینجا هر سطحی رو سعی بکنید دست نزنین موقع دست بزنی با دستکش دستتون بپوشونید. درهای به اصطلاح در رو که باز میکنین یکی از شایع ترین جاهاست. دوم، رو لباس ها وقتی به اصطلاح سطح سافت هست، روی سطح سخت ویروس چیز حدود 2 روز عمر میکنه. بعضیا میگن تا حدود 1 هفته ولی حداقلش 2 روزه. روی سطح صاف چند ساعت خواهد بود. در نتیجه سعی بکنین با به اصطلاح تماس دست به هر سطحی و تماس دست به دهن رو کنترل بکنین، غیر از نزدیکی و به اصطلاح دوری از آدمی که به اصطلاح مبتلا هست. With that, I'm going to convert back to Dr. Parisa Kamali. Dr. Kamali, I hear that you're in an emergency room hospital in Netherlands, in Holland, and you take care of patients with coronavirus. Number one, we wish you health. So if you could kind of tell us how you prevent you being contaminated. Also, tell us, share some of your experience with the physicians and the nurses inside Iran, please.
Hi, thank you for this opportunity. I'm Dr. Parisa Kamali, intensive care resident working in the Netherlands. One of the first corona diagnosed patients in the Netherlands came to our department, and I was on call that day. The patient came in with mild respiratory problems and fever, and within 24 hours we had to intubate that patient. Since then, the virus has spread aggressively throughout her lungs, and she was unstable for a very long time. This virus, as we all know, is not a normal cold or influenza, but yeah, it's much more aggressive than we first thought as physicians. Since the beginning, we as doctors and healthcare providers had the right equipment and protocol how to handle such diseases and cases. And as of last week, we all have been implemented the pandemic protocol that we have in our hospital and also nationwide. Everybody is now in a state of emergency and has to be on call 24/7. As you know, the coronavirus has spread to 152 countries, affecting more than 150,000 people. And once nations realized the dangerous character of this virus, they all took extensive measures to ensure public health. The Dutch government has been following the spread of the virus in the Netherlands continuously, and most importantly, it has been open and transparent to its citizens by providing hourly updates. The hospital have created more ICU beds. Our hospital has gone from 15 beds to 42 ICU beds. The government comes with advice and precautions to the general public, and due to this knowledge and awareness that has been created in the Netherlands, people are taking the precautions, are washing their hands, and most of public life has been banned as of last week. In my hospital, we have also taken measurements and are fully prepared for the corona crisis. We are at this point not yet in a peak of infection, but all the nurses, all the doctors, and all the healthcare workers are fully prepared. In Iran, however, reports indicate that the colleagues, doctors, nurses, and medical staff are in dire conditions. Many are deprived from the protected suits and basic necessities in order to treat the patients, and the number of medical staff losing their lives is constantly on the rise. I was on call last night, and one of my colleagues said that she was really happy that in the hospital she felt safe and she was ready to take care of all the patients that are yet to come. And I can't imagine how it is for my colleagues in Iran that have to fear their own life because of this virus, and in the other hand, feel the responsibility to care of the patients. Iran, as you all know, has systematically showed a low mortality rate to cover up. The official number provided by the WHO is 611 as of yesterday, but the reports state that it's more than 4,000 people have passed in Iran. The coronavirus is taking the lives of many Iranians, and we are losing many colleagues, friends, and family due to this pandemic. The number one rule of preventing the virus to spread is transparency and unity within a country. Since the beginning, the regime has prevented news of the epidemic being broadcast in order to continue their own agenda. The IRGC is taking advantage of the situation by making a fortune selling products at a higher price on the market. Lack of medicine and medical gear is killing my colleagues and our healthcare workers in Iran. The regime has applied for 5 billion aid from the International Monetary Fund under the pretext of fighting coronavirus. All international aid must be sent directly to the hospitals and the public without any interference of this regime. The mullah's regime, as we have seen so far, is not qualified or capable of containing coronavirus within Iran. Whatever money is given to this regime will be plundered and nothing would reach the public in Iran. As Mrs. Mariam Rajavi has said, we urge the WHO to directly oversee the dire conditions of my fellow medical staff in Iran and submit a report on that to the UN Secretary General and the UN Security Council. As an ICU resident, I stand by my dedicated and sacrificial colleagues in Iran who are giving up their lives to fight for our people. We will be your voice here and we will fight the same enemy within the hospital and in Iran. Thank you.
Beautiful comments you made. Thank you. The next guest is Dr. Ashraf Zadshir. Dr. Ashraf, you have expertise in managing the HIV, and also you, at the administrative level, you manage a very busy clinic. As you know, the confirmed reports from inside Iran have reported that the mortality is about 4,500. And this is the report that we have confirmed by inside Iran. Could you please elaborate on the methodologies, both in terms of the medical management and administrative management that you see fit?
Thank you for having me. As you mentioned before, let me talk about HIV and AIDS pandemic. As a deadly disease, in the United States, now the HIV and AIDS became a controllable and preventable health issue. And this wouldn't be possible without the active participation and support of government and governmental health organization at the federal, state, and local level. In regard of the approach to coronavirus outbreak and pandemic, they have the same principle. The government has made the battle with coronavirus at its top priority. They direct all the resources and the support system towards this pandemic. They have from isolation, from all the matters that my colleagues have mentioned, that goes in Australia and European and the US. The reason is that because they made it as top priority, they take all the necessary measures and steps in order to keep the exposure risk to minimum, and also the risk of death. But in Iran, what was the first reaction of the regime to coronavirus outbreaks? As my colleagues mentioned, they hide the information, they covered up, and in addition, lack of isolation of the city of Qom, ground zero in Iran, continuation of air transportation and travel to high-risk locations such as China, the mismanagement of medical supplies and resources due to IRGC's corruptions and hoarding and Khomeini affiliates. All of these caused the dramatic increase and spread of the virus and increase the fatality rate. So as I think that Madam Rajavi said very adequate, that the only things that matter to this regime is to keep its own grip on power. The people's lives, health, and resources have no value to ruling mullahs. The people of Iran suffered the greatest damage and losses as a result of external war, domestic issues, poverty, unemployment, and illness, like you are seeing today. I believe, as Iranian physician that has a background in infectious disease, and especially the other pandemic disease like HIV, I believe the first and most important steps is to remove and kick out the IRGC's people and Khamenei affiliates out of the hospital, and remove all the medical supplies and resources, as all my colleagues mentioned, out of the hands of IRGCs, and made them available to the nurses and doctors in Iran. I believe that international community and health organizations have the moral and I believe that legal obligation to support the doctors and nurses in Iran who are the front line of battle with this pandemic. And WHO, especially WHO, has very important role to put pressure on Iranian regime and help the Iranian people and the nurses and doctors in Iran. This is the steps that we have to take it, and we will be with the Iranian colleagues in Iran, and we, as our colleagues mentioned, we will be your voice around the world to get you help. Thank you.
Thank you so much, Dr. Ashraf. Could you just in Farsi give us a few preventive measures for people in Iran who are listening to this? If you be brief, please.
حتما. ببینید یکی از مهمترین مسائل که باعث پروونشن میشه، باعث جلوگیری از ویروس میشه، این هستش که کنتاکت رو کم کنیم. کنتاکت میشه اکسپوژر و شستن دست با صابون و آب به مدت 20 ثانیه خیلی خیلی مهمه و واقعا مهمه. اینجا ما توی هاسپیتال و توی کلینیکی که بسیار بسیار شلوغ هستش، ما عکس گذاشتیم که حتی هلت پرووایدر چطور دستاشون رو بشورن و من میتونم پیکچرش رو بدم، ولی 20 ثانیه باید باشه. باید حتما بین دستاتون رو بشورین، باید حتما اینجوری کنین، باید همون استپ ها رو رعایت کنین و دقیقاً یعنی یکی انگشت ها رو بشورین با صابون. این یکی از ریسرچ هست نشون داده که یکی از مهمترین عواملی هستش که جلوگیری میکنه از انتقال ویروس و بقیه چیزها هم که شما و کالگ های دیگرمون همه در موردشون صحبت کردن.
Thank you very much. I'm privileged to have still Dr. Lederman, if he's still online. I have a friend and a distinguished professor, Michael Lederman, who's a Scott Inkley Professor of Medicine, Professor of Microbiology, Molecular Biology, Pathology, and Biomedical Ethics. Gee, I'm running out of breath. At Case Western Reserve University, and the editor-in-chief of the Pathogens and Immunity, a journal. Michael, are you online?
I am online. Can you hear me?
I'm hearing you very well. Thank you so much. Michael, I really appreciate your patience with us with this Farsi and the English speaking. So it was good for your Farsi learning anyways. Michael, you bring a different perspective to us, and you've known a little bit about the resistance and what's going on. But you, more importantly, you have an international perspective of basically this panepidemia. So if I have to share, maybe I kind of abuse my system here in terms of sharing. I have seen these two curves of epidemic, how it will be handled. If the countries don't handle it properly, you're going to have a very tough peak and a drop trough, which a huge mortality, as I think we saw in China maybe, and then in Iran. And then if you are prepared, you're going to have a soft landing. So that is kind of my readout of this pan-epidemic. And as you heard through the comments, the issue is really which policies you think are effective and which policies are deceptive. As you heard from my colleagues, seems that the Iranian regime is more after their own survival than survival of the people. Please elaborate.
Right. So first, I should confess that one, I'm not an epidemiologist. I am an immunologist, and I've been trained in infectious diseases, and I've been studying HIV and AIDS since 1982, and that's where my experience comes from. As you alluded to, it's critical that the curve of the epidemic is flattened, because even if you don't ultimately have a large effect on the total number of cases of serious disease seen over time, if you see them all in one day, you'll obviously overwhelm your hospital capabilities. But if you see them over many, many months, then hospitals will be able to provide care. I guess that's the curve you're putting on right now. We'll be able to provide care on a regular basis to all those who need it. So there are numerous policies that can be implemented to do this, and they involve policies on an individual basis. We advise our citizens to wash their hands. We advise our citizens to not shake hands when they see friends, to not hug their friends and neighbors. We advise citizens to cover when they cough, or if they can't cough into an elbow. And we propose social isolation or distancing, staying at least 6 feet away from another person, because the virus is most likely carried in droplets that are exhaled during sneezing, coughing, and maybe even with breathing, and they tend to fall to the ground within 2 meters. So here's something really important. Young people who don't often feel as though they're at very high risk are still in some places tending to congregate in bars and in crowded places. And it's important that everybody recognize that not only are they protecting themselves when they institute these changes in behavior, but they're protecting everybody else. It's almost as though this is a civic duty, and people need to recognize that it's not just the young people that they're protecting themselves individually, but they're keeping infection from the 2 to 3 other people that they're likely to transmit to if they get infected, and to the 2 or 3 other people who are likely to be receive infection from the 2 to 3 other people that they transmit to. So this is how epidemic curves are attenuated at some level. On a national level, I've heard you say, or people on the call talk about the importance of canceling large events. In the state of Ohio on Friday, our governor stopped all schools. Our universities have stopped having classes. Large meetings are discouraged. Our university is discouraging any meetings of more than 25 people. And it's recommended in New York City, for example, that bars have no more than half maximal occupancy. I think that's too lenient. I think that bars and restaurants should start thinking about delivering food rather than serving it on site. That's my opinion. Religious services. I think that religious services, I know this is difficult for people who feel strongly about their religious beliefs, but I think this is a time to reconsider the need to meet and congregate in religious services. From a hospital perspective, hospitals are preparing themselves. It's absolutely essential that healthcare workers be protected. They're the front lines of care, and in places where healthcare workers are not protected, this will be disastrous. So, lastly, the only other things that I could possibly mention are the symptoms of disease that individuals, physicians need to be aware of. This is a lower respiratory infection. Fever is seen in almost all. Cough is seen in many. Myalgias are seen in many. But interestingly, upper respiratory symptoms of rhinorrhea are unusual. They're seen in only a minority of individuals. So if you're making a decision about, what to suspect, upper respiratory symptoms so far appear to be uncommon. Lastly, in terms of individual behavior, keep your hands away from your face. Don't because when you get if you get contaminated by your hands, gets into a person through the respiratory tract and not directly through the hands, but you need to get into the mouth or the eyes or the nose, and that's hard to do. Most of us put our hands to our faces all the time. A little bit about treatment. It's not clear whether any treatment is effective against this virus, but there are some active agents that look to be active in the test tube, specifically remdesivir, which is a nucleoside analog made by Gilead, an experimental drug not yet approved for any indication. It's only given intravenously, but it does look to be active in vitro. Another agent that's oral that looks to be active in vitro is hydroxychloroquine. Hydroxychloroquine and chloroquine both seem to have some activity. Whether they're useful in this disease remains to be determined. And finally, a protease inhibitor, a combination of lopinavir, ritonavir, also an oral medication, a little hard to tolerate. It's an anti-HIV medication, seems to be active in vitro. For people who are desperately ill and in the intensive care unit, there seems to be a cytokine storm with elevated levels of numerous cytokines, particularly among them interleukin-6. And for this reason, the government of China has just recently approved, last week, an interleukin-6 receptor blocker for treatment of COVID-19. The agent is called tocilizumab. It blocks the IL-6 receptor. We've used it to treat people with HIV disease with some interesting immunologic results. Whether it's useful for the treatment of the very ill person with cytokine storm and COVID-19 remains to be proven. However, in the States, in individuals who receive CAR T-cell therapy for malignancies, who sometimes experience a cytokine storm, administration of tocilizumab, an interleukin-6 receptor blocker, has attenuated the severity of disease. So I hope that's of some help to you.
That was great, Michael. As usual, I learned from you. Michael, I'm going to ask you two questions because you're you're a non-Iranian participant here, but at the same time, you have personal experience with the other disaster at the humanitarian level, like the Holocaust. So one of the kind of conspiracy theories that the Iranian regime has spread is that this is a biological attack against us. Somehow manufactured the virus, and the supreme leader, rather than putting the resources at the hands of the medical resources, putting in the hands of the IRGC, the military arm, telling him that this is basically a biological attack. Could you share your comment? This is the first time I'm asking you, just as an expert, just tell us, isn't this ridiculous? Or I won't rephrase it. So you tell me what you think.
Yeah, I see no justification for that hypothesis. This virus is a bat virus that went through an intermediate host, probably undoubtedly somewhere in Wuhan, in China, in the markets, and jumped from one species to the next. This was predictable. This was predicted in the early epidemics of SARS-1 and MERS, and in fact, our President Obama did establish an organization within the United States to prepare for global pandemics like this. This was dissolved by President Bush and John Bolton in 2018. But the idea that this was manufactured in a laboratory is utter nonsense.
Actually, we have a list of the questions from the from reporters. I think this answered the question for Hossein Al-Badwi from Al Riyadh, which is a paper in Saudi Arabia, that this is not a manufacturer. There's another question that I would address to Dr. Sajjadi. Dr. Sajjadi, there's a comment here that the Iranian regime is sending actually some of the infected people to the areas of Iran where they have worries about basically controlling those areas, including Kurdistan, which is I think is another evidence of the genocide from this regime. Could you make some comments on that? This is so disturbing. I mean, some of these questions are coming, and I can't have to control my emotions here.
Yes.
Dr. Sajjadi.
Yes, I think something very important about this epidemic is that to contain this epidemic and goes back to the curve that you were showing as far as being very steep and high to a more flat one. And so to contain this virus, the exposure should be very limited. We need to take actions to limit the exposure. Now, if you send those who are already infected to the areas which are not, that's actually active spread of the virus, and it just doesn't make any sense. So the first rule is to contain and then to mitigate, meaning so we need to isolate those who've been diagnosed with this, quarantine them, and then also try to mitigate, meaning to flatten the curve, so then the community could deal with the disease. Because again, if, as doctor was saying, is that if all of the infected people, it happens in a short period of time, the country cannot deal with it. So we need to provide ample time, so then the medical resources could be given to those who get infected, given that this is an epidemic and it's going to happen, but we need to take precautions to make it more limited. And what you just said as far as spreading this virus, I mean, it just goes against just common sense, not just medically, it's just against common sense.
I think, let me see the questions is, I think from Mr. Hossein Nejad from Italy. I don't know if we heard your comment about this militarization or militarization of the situation. Are you still online? If you're not online, I'm going to ask quickly from Dr. Lederman, because he's been patient with us. Michael, again, from a non-Persian Iranian perspective, and as a distinguished physician, how do you see the policies of whether the resources should go to basically medical infrastructure or should go to the military? Could you just?
I'm Firuz. I'm not a politician, but obviously,
you have a very good.
Dealing with a crisis like this requires intervention at multiple levels, and the interventions should all be targeted to protecting the health and of citizens and the society itself. It sounds from the discussions that I hear that Iran's policies are not consistent with that goal.
Again, I think you're not a politician, but the common sense says it has to go to resources what could prevent the epidemic rather than, strengthening their military hold. Dr. Ashraf, I think this whole concept of the contamination of selected areas in Iran, that seems that the Iranian regime is using as a policy. Could you elaborate on that?
Sure. The reason why the virus going to even prisons and to certain areas that is a risk to Iranian regime, the existence of Iranian regime, is that the Iranian regime wants indirectly to vanish those people, the resistance. So that's the reason why they take the coronavirus or the infection to the like prison, because they are, as you mentioned, 12,000, and one of the colleagues mentioned 12,000 political prisoner we have within the last November uprising, only during the last November uprising, and they don't have access to any medical supplies, any resources, any hygiene. So what if one person, imagine that it's one person get infected in those prison or the Kurdistan, where the uprising is high, or the other cities that it might be a risk to the Iranian regime, the population, they easily can infect it with the virus or remove all the hygiene and resources that they can fight against this virus outbreak, and the people get vanished. What are you going to do? They said, okay, it was due to the viral infection and it didn't have to do with us. That the comments that I wanted to mention regard of, not being on top of the issues on certain areas.
Yep. I think this is, I'm reviewing the questions that have come, and I apologize to reporters if I missed reading their names. I'm just going to make sure that they were, we asked a question, Mr. Hossein Al-Bawadi from Al Saudi newspaper. I think we read his question. We read it from Lavan from London. The issue of the selected regions where regime is sending the contaminated people. There was Mosni Chadorchi از سایت کتابات سوال کرده بودن که رژیم ایران ستادی رو به اسم رئیس ستاد به اسم ستاد ویروس درست کرده و ارتش آقای باقری رو برای مقابله با ویروس گذاشته و به نظر شنونده ها این ستاد برای چی تشکیل شده و چجوری میشه روی این حساب کرد. من فکر کنم اینجا دکتر سجادی شما اگه میتونی یه کوتاه به ما کامنت بدین خیلی ممنون میشه. If you say it in English maybe or Farsi.
Sure, Farsi. Yeah.
Say it in English, yes, please. Yeah.
English. Okay, so the issue is that this regime, because the nature of it and where it is right now, regard everything as far as its survival. So the issue is not virus being a health problem. The issue is that how this could affect its survival. So whatever it does is to manage the risks which comes from this virus for its survival. So I think what one issue is very interesting to me is that right now the Iranian people are dealing with two threats. One is the regime and the other one is the virus. The virus requires distancing, but for the Iranian people to take care of the main problem, the Iranian regime, they need to get close to one another. So this is a dichotomy that our people in Iran are dealing with, and they need to come up with a solution. Because for Iranian people, while they are trying to contain the problem of virus, there is more need. And this virus proved that we need to take care of the main problem, the Iranian regime. So there should be a happy medium here. And those who are on ground in Iran, they're in charge of to resolve this conflict, this dichotomy. And so going back to your question again, the Iranian regime tries to have certain institutions in charge, so it would contain the problem. It would help to suppress people. And again, I want to go back to your question you had as far as the viruses, or those who have the virus, sending them to regions such as Kurdistan, is that maybe regime wants to, by spreading the virus, brings fears to people and causing people to distance from one another. Again, if we go back to what I just said, that in order to take care of this problem, regime, we need to get close to one another. In order to take care of the virus, we need to distance from one another. And regime sometimes may be trying to use this virus in order to distance people from one another by sending the virus, say, to Kurdistan, to spread the fear in a way.
Yeah, thank you. I'm going to ask the same question from Dr. Nariman and Dr. Zahedi. At the same time, I'm sharing the slides that the Washington Post and the CNN reported on the burial sites that the regime is preparing across several regions in the country. So this is, in my opinion, this is the natural history of militarization of a medical disaster. So they're basically ready to bury people rather than trying to keep people alive. Dr. Nariman? If you're online, if you're not Dr. Zahedi, are you online? We need to unmute Dr. Zahedi in Australia, please. Let me see if I can do it from here.
Yeah.
Goria.
I can. In English or Farsi, please?
English,
Farsi?
please. Yeah.
Yeah. In general, we know the behavior of the regime in Iran. They have been using this propaganda on the comparative manners. First of all, any disaster in Iran immediately is compared with the disaster somewhere else. So the spread of this virus to other countries is a blessing for them. If, say, you hear in mass media in Iran more news about people dying in China or falling dead in the street in China or Italy or other countries than really reliable news in Iran. That's number one. So Iran keeps comparing disaster with disaster to keep the population shut down. Secondly, it wants to keep the people calm, that you are not the only people in misery, so everywhere else is the same, so keep your mouth shut. Secondly, is that by doing this, that I think there were reports that Iran really doesn't mind if the virus is spread to other countries and killed non-believers. Remember, this is the regime based on ISIS. The ideology is a fundamentalism, and as a result, to kill non-believers with this virus is a blessing. It's a lot cheaper for the regime to kill non-believers through this bioterrorism that is promoting, rather than sending missiles to the American bases in Iraq or in Saudi or in other countries. So the bioterrorism is a new weapon for the Iranian regime, I believe. Thank you.
I want to thank everyone who is not speaking Farsi for the privilege of allowing me to moderate this session, and also learning from my distinguished colleagues, and with the hope that the end of this pan-epidemic, both in the world and especially in our beautiful homeland in Iran, will coincide with the termination of this, the mother virus of Velayat and the coronavirus. Thank you all so much.